thought it was time for me as a breast cancer surgeon to give more thought to what Breast Cancer Awareness Month means. And after giving it more thought, there are three things that I think that you should know. Number one, what can you do for others, most importantly? What can you do for yourself to help yourself do better or prevent yourself from getting breast cancer? And number three, if you are motivated, what core value do you have to help others and help yourself along the way? So, helping others, it is the most blessed thing that we do. And I think that it's so important to think of others that have had breast cancer, or family members or friends, and reach out and touch them. It is the act of kindness and warmth, which is what we do as humans, as physicians, but most importantly, friends and family, that is what is important. And think that someone that's had breast cancer not only has had to endure the pain of surgery and other things, but more importantly, the psychological pain and trauma of having their entire life upended and uprooted and having to reassess who they are and where they are in this world. What can you do for yourself? Well, the key thing to remember is get back to getting an annual mammogram if you're 40 or older. COVID upended all of screening. It's all coming back, and it's all open now. But it's so easy to fall off the wagon of doing something annually that's really kind of a pain anyway, and it's easy to not return. And that's my main message to you, is make sure you go through the hassles of trying to get a mammogram order and getting back to getting an annual mammogram. It really saves lives. What we're working at the National Cancer Institute about, and I think you should know this, is that identifying whether you're at a high risk or meet the qualifications for genetic testing for the breast cancer gene, the BRCA mutation, or other cancer-causing genes. And some of the red flags that you may, or a friend may have, or a family member might have, is having breast cancer before the age of 50. Anyone with ovarian cancer meets the criteria because they're at high risk. A family that has a man that had breast cancer. And there are other cancers such as colorectal cancer and uterine cancer and pancreatic cancer that are all relevant in testing for all of these genes. And if you have that, then we can take better care of you and more intensive screening and find cancers, because you're at a super high risk for getting breast cancer, ovarian cancer, or other cancers. Beyond genetic testing, what we're trying to do as a nation is trying to identify who's at a higher risk than normal, strong family history of breast cancer, for example, and make sure that those women and a few men get the screening they need and get the care that they need. And engaging your physician, engaging information online to learn if you're at a high risk for breast cancer is super important. The last thing I think I would like to share is that find a core value within you, something that's important, whether you're good at it or not, and then contribute that to either your friends or family or people that you know that have had breast cancer. But also, if you want to contribute to breast cancer organizations, your time, your energy, your resources, find what you're good at and contribute that. I found that I felt that I was good at educating women about breast cancer in my practice, and because of that, I created the largest online breast cancer school for patients. So find what you enjoy doing and follow through with it. It's hard work, but ultimately doing for others and putting the time in to get it done is worth all of the work and makes life so fulfilling. So from a breast surgeon in Northern Virginia, and a breast cancer advocate, that's what I think Breast Cancer Awareness Month means to me.